Hello, my name is Russell Myers. Welcome to Issues Unite. All right, so the other day in his speech, President Biden said, healthcare should be a right, not a privilege. And those are great words, great words. The problem is his actions, his proposals, go in direct contradiction to his words. Let's start with the American Rescue Plan. I've covered before how in the American Rescue Plan, he included, $52 billion, which was to subsidize COBRA, continuation of existence, insurance. And the money didn't go to the people that had the insurance in any way. It went to the insurance companies. So the people still had, that allegedly benefit from this, still have, deductibles, $3,000, $6,000. Is that helping them if they don't spend that much money on medical care in a year? No, it doesn't help them at all. This only benefited 1.3 million people at a cost of $40,000 per person. Just consider what an alternative to this would have been. Okay? Let's consider, instead of, $40,000 per person that was paid to insurance companies that can deny your claims, let's say instead they issued debit cards, $10,000. Then you would be covering 5.2 million Americans, $10,000 each. Payable, only used for medical care. You go to your doctor, you give them the debit card, your fee is paid. Okay? That's it. There's no more, there's virtually nothing. Yes, they have to account for what services they provided to the government, but it's easier. It would be easier for the doctors, easier for the patients. Make those cards have no expiration date. Make the balance on those cards transferable so that if you only use $2,000, you have a family member or a friend, a coworker that learns they have cancer, you can donate the other $8,000 to their account. This would actually provide medical care to people that need it. But going forward, he wants to expand the ACA, which means subsidies which get paid to the insurance companies. Well, first of all, this is highly unstable because, that means that you have to continue those subsidies. You have to, and there's no promise that those subsidies will be continued. Not when we have Republicans that are going to vote against it, and even some Democrat, centrist, let's face it, right-wing Democrats like Manchin and Sinema in office that will vote against this. The problem with the proposal that, like I said, just issuing debit cards for medical care, is that this would be proof in concept on American soil of universal health care being successful. But we don't really need another example. We've got the Social Security system. It has been, since the 1960s, the most successful government program in existence. And prior to George W. Bush, we tend to look at Medicare right now as Medicare is right now. People forget that prior to George W. Bush, he privatized part of Medicare and Medicaid. We didn't have a Medicare Part D back prior to George W. Bush. You went to your doctor, Medicare paid. You went to the pharmacy, Medicare paid. Your health care was paid for. Yet you reached a certain age. And by the way, the age was raised. Remember, it used to be 60 years old. And now it's 65. And our government is talking about raising it even higher to 67 or 70. There are different influences in our government that want to raise it even more. Claiming that health care is a right by this administration is a flat-out lie. It is an absolute lie. And it doesn't even stop at our shores. Look at how our government is handling intellectual property on vaccines. Our government is not going to share the technology necessary with other countries so they can produce their own vaccines. And internal documents, which you can find for yourself, have shown that one of the biggest reasons they don't want to share this technology is because they are literally afraid that Russia or China or some other country might use this technology to develop cures, actual cures for cancer, possibly heart disease, malaria, illnesses which kill millions of people per year, illnesses which the U.S. drug companies do not want cures for because they make a lot of money off of this. We have a lot of options available which this administration is not going to take. Stop all this feel-good bullshit about Biden actually saying the words that health care should be a right. Yes, health care should be a right. Medicare for all should be a reality. Universal health care in this country should be a reality. We are the only developed country that does not have it. And we rank number 11 out of 11 countries that were audited on the quality of health care. So we pay more, we get less. Millions of Americans forego medical treatment. I myself, my nurse practitioner wants me to get a repeat colonoscopy. And it would be a good thing, but I can't afford it. So I deal with things that I won't go into here. But for the last few weeks, I've been fighting a flare-up of a condition that I've got, which is why I slowed down on doing videos. It was because of health issues. I cannot afford what my doctor wants me to do. I just don't have that option right now. Anyway, millions of Americans, they are at threat of going into bankruptcy. Millions of Americans declare bankruptcy every year because of medical expenses. How is this a right? How is healthcare a right? How is what he is proposing making this a right? The only thing he's making it a right, making into a right, is for you to pay into corporate profits. That's the only thing that he's actually doing. And I don't have insurance right now. It doesn't make sense, because in an average year, I don't pay as much into medical care as I would pay on insurance premiums. Then you throw the deductible on top of that and the co-payments on top of that, and the chance that they'll just refuse to pay for it. And you're already looking at, at least $10,000 if I actually sought care. How is this a right? But he is going to try and reinstate the individual mandate. I'm still not going to buy corporate insurance. Yeah, I'll take the hit. I'll take the fine instead of paying for corporate profits to keep the same system going. I'm not going to do it. I have no idea who that is. All right. So we have a lot of options. If we took the subsidies that are being handed out to insurance companies for COBRA, for the ACA, and we instead issued medical debit cards, that would be actually providing some level of medical care to people that don't have it right now. And it would be a very realistic proposal. But they don't want to do that, as I said, because it would be a proof of concept that it actually works. That this is a form of universal health care that would actually work. And we can't have that. Joe Biden is in the pocket of the insurance companies. Make no mistake. Share this video. Talk about these subjects. And I'm going to be doing a separate video on the vaccine, intellectual property. So I'm not done with that one yet. Anyway, like I said, share this video. Talk about these subjects. If you can, please donate $1 a month to help expand the channel. And I want to give a tremendous shout out to John Schumacher, who donated to the channel. I thank you very, very, very much. That was a very generous donation. I appreciate it more than I can tell you. Sorry that it happened right when I was sick, but I'm getting back to being myself slowly. And I'm going to be picking up the content again. So, again, share this video, talk about these subjects, and I will catch you in the next one.